Hi there, I'm Leslie with the St. Johns County Public Library System, and today I get to speak with Maria Thomas, who is with Wildflower Healthcare. Hi there.
Hi,
I'm so glad that you're joining us for this very important but maybe misunderstood topic of menopause.
most definitely. Yes.
Yeah, so what can women expect as they get older and their bodies start changing and we think we might be going through menopause?
A lot of times, menopause is self-diagnosed initially because the woman is the one that kind of those first symptoms start occurring and we know something's changing, but we just can't put our finger on it. And a lot of times too, it's happening earlier and earlier. But hot flashes is the number one complaint. And a lot of times the patient doesn't know it or the woman doesn't know it. They're walking into a grocery store or they're grocery shopping or they're sitting having a phone conversation, and all of a sudden it's just this undescribable heat source that comes from somewhere. And it's usually the face and the chest, and then it just kind of goes from there. But it's an extreme hot flash. And those are usually the first symptoms: night sweats, fatigue, tiredness, and that could be other things too. So we kind of get confused of what exactly is happening, but we know something's happening.
And does it also kind of differ between women? They might have some, I've heard, do not really have any or very minimal symptoms, and then others do have full blown, miserable symptoms.
That is so true. Some women just skate through it and don't have any symptoms at all. And, they have that year, the 12 months of no menstrual period. And they're like, oh, well, I'm in menopause. And, they're like, okay, that's over. And then some women, they can have symptoms 10 years before they actually hit menopause.
And is
So,
that perimenopause? Okay.
yes. So perimenopause, menopause, and then postmenopause. Perimenopause is that up to 10-year span that you can have all those symptoms. And then menopause will be that period where it's 12 months where you have no menstrual period. Then they can diagnose you as being in menopause.
I have heard from some women that for various reasons, they, I guess, go through that menopause early, whether it's due to a hysterectomy or maybe chemotherapy, and maybe they were not quite prepared for, that natural progression that maybe happens to other women.
Exactly. So if they go in and they do a partial hysterectomy or a full hysterectomy where they take the ovaries, then that definitely throws you just immediately into this menopausal state to where there was no gear up to it. It was just you're there. So I think that's challenging for those women, definitely.
One thing is, maybe having a great relationship with your doctor and feeling comfortable about talking about these symptoms that you're experiencing. And there are many symptoms. We have some materials at the library that are available for checkout, also digital materials. But the list of symptoms, there's weight gain, there's, not maybe sleeping as well. It's the hot flashes that you spoke about, and, decreased libido. It's a lot of things that affect not only the woman, but, those around her as well.
Oh,
Are there
absolutely.
are there things that we can do to maybe help minimize those symptoms?
Definitely. You'll find triggers you can sometimes notice and correlate it. And it's not for everyone, but there are certain triggers for certain women, like caffeine, alcohol, spicy foods, or sugary foods. Those will actually can be triggers to where it encourages those hot flashes or those hormonal imbalances. So just watching diet, there's been studies that Mediterranean diet has been the best diet to follow during this time, or the not as a keto diet per se, but just following something a little that works for you. Basically, once you find those triggers and just eliminate those foods. Exercise is a huge thing. The studies have shown that adipose tissue actually holds on to more estrogen. So women that are overweight, if they lose weight, the hot flashes decrease. So that was something interesting to hear too. Diet, the exercise, and then with that vaginal dryness, then there's creams and there's other things that you can use as well. And then they do have hormonal replacement, and some people do opt for those. And then also just that natural exercise diet, try and just minimize those symptoms.
One thing that women do have is maybe a family history of breast cancer or maybe other cancers that might prevent them from being able to do those hormone replacement therapies.
Sure.
Are there maybe some natural, other than the exercise and the diet, are there some supplements that, might be able to be taken?
There are a lot of supplements out on the market. A lot of the studies have shown it has a placebo effect, not an actual effect. So if it works for you, it works for you. I guess, however, it helps, that would be great. But studies have shown it's more of a placebo effect.
Okay. And then I guess with any supplement or even vitamins, you do want to let your doctor know, this is maybe something you're interested in taking or that you've started taking, just to make sure they do know everything that you're doing.
Definitely. And a lot of times too, a primary care may refer you out to endocrinologists just because they specialize in this type of field. So they may know other suggestions or other routes that you can go, especially if you can't do the hormonal replacements.
That's great to get any kind of information, because this is, an article that I read is we're prepared or we're educated on starting your period and then childbirth, but there's maybe not as much about going through this other transition. So,
and I don't know if it's just been this taboo thing, in prior generations where they just didn't speak about it. Now we have this social media platform to where pretty much everything's spoken about. So that's great that we can open this conversation, because women, I'm in my mid 40s. So coming up to this, and I start talking about my family and my parents and my mother, because she had an early, went through menopause early. So that was great to learn that, to know that, hey, this is going to be coming up for me and I need to be prepared. And what changes can I make now? So, watching my diet, exercising, putting those things in place, maybe to help that curve and not be so horrible. There are a couple websites that I think are really great. One is hormone.org, and it's ran by Endocrinology Society, and it's Hormone Health Network. But that's a great site to go to, because they have like this little questionnaire thing, and it pops up, have you been having these symptoms? You click yes. Have you missed 12 months? And it says no or yes. And it just kind of like pushes you to what they think, what stage you're in. So, which is nice.
Now, Maria, I also read about, I guess, potential bone loss, increased risk of heart disease, and then, of course, the trouble sleeping. Are there recommendations that you have to help with those topics?
So the osteoporosis aspect of it, you want to follow that either bone density scan. You can have one of those scans, or you can just talk to your doctor and get like some type of blood work levels just to see where you're at. You may need a supplement. And that's good to know going into it. So if you're starting to have these symptoms, just to get ahead of the game, because we know that bone loss does happen as we age. And it's just like a downhill, slide, unfortunately. So that calcium supplement may be something that needs to be added to your diet. And then that will help too with that bone loss, because with the bone loss, and then our balance also gets a little worse as we get older. So then the fractures increase. And then along with the cardiovascular disease, those hormones play a really important role in our heart health. But not having those hormones will inevitably also, trigger those diseases, that something may be underlying or something that's new that comes up from it.
So definitely keeping the good diet, exercise, I guess some strength training to maybe help with the bone, keeping those as strong as they can be, some cardio for the heart health.
Because calcium's great. So if you take calcium can only get in the bone if you're using your bone. So walking 30 minutes after taking that calcium supplement or something like that to make sure that calcium gets into where it needs to go is key.
Now, what about trouble sleeping?
Yeah, insomnia is really big. And they've done a study too with just the digital world included. I listened to this guy and he was saying, that first 60 minutes of your day is to not be engaged in anything electronical because the repair that your brain did the night before, if you go into that electronical digital world, everything that your brain just repaired, just kind of, you deleted everything. He's like, you have to give yourself that 60 minutes every morning without that digital world to make sure that those repairs are intact. So you get that more, brain connectivity, and then it actually prepares you for a better sleep the night, the following night, which I thought was really interesting.
It is. So maybe instead of reading your newspaper digitally, you get the print copy.
Right.
Enjoy your coffee. Hold
at least
off
for the first 60 minutes.
Yes.
No digital, like usually an hour before you go to bed, they say also helps too. So just kind of disconnecting, I guess, is better to say, is disconnect in the evening, kind of do whatever you need to do to decrease all that stimulation, and that will help with the evening sleep.
Can you also tell us a little bit about Wildflower Healthcare and all of the wonderful things that you all are doing in our community?
Well, we are a free clinic that offers free healthcare, medical and dental to those who qualify. So we give them the clinic aspect of it, and then we also have the outreach. And in our outreach sector, we have partnered with Flagler Plus Buzz, and we go out into the community once a week into different areas. So we bring a provider and a nurse, and we bring the clinic to them. We do educational trainings at various different locations, Alpha Omega, St. Gerard's, Ready to Learn, just a few to mention there. But we do go out into the community, spread education, and we love to educate people and then also give them that free medical care.
Well, that is wonderful. And we so appreciate what you're doing for the community and what Wildflower Healthcare is doing. So thank you.
Thank you.
And thank you for helping enlighten us on this very important topic of menopause and what to expect. If anybody has questions or if they want to reach you for maybe some outreach that they're doing or they know of a population, is there a phone number that they can call you?
Absolutely. They actually, if they want to email me at volunteer@wildflowerhealthcare.org. I work in outreach, so I'm always on the go. So emailing me is probably the best way to connect with me.
Well, thank you, Maria.
Well, thank you. I enjoyed it.